We are here and we are strong. Let's be counted as we move on. Make a difference, change lives as we tell our different stories. We are capable, beautiful. We are born to do great things. We're unstoppable, incredible, 'cause we're differently abled, differently.
Hello and welcome to Able Differently, where matters persons with disabilities is our core business. My name is Jane Theuri. Karibuni.
Abled differently.
The right to access affordable and acceptable quality healthcare is guaranteed in the Constitution, including sexual and reproductive health services. Today, we want to find out how accurate this is for persons with disabilities. Take a look.
Reproductive health is a state of complete physical, mental, social and emotional well-being regarding reproductive system and not merely being without disease.
Sexual reproductive health definitely means someone being able to decide for themselves. You can decide what is your sexuality. You can decide whether you want to give birth or not. You can decide if you want to have a relationship that is involving sexual activities or not. So that is your sexual reproductive. It's majorly focused on the sexual reproductive health autonomy, where you decide what you want to do with your body as a woman.
So reproductive health will come in before pregnancy. So before pregnancy will be divided into adolescents, and then the people who are in the childbearing age, and then after that will be the women who are pregnant, and then after that will be then the post-pregnancy and on to menopausal and death with dying. So how we manage all that is under the reproductive part of the patient.
While piquing the mind of a cross-section of the general public on this matter, there seems to be a wide range of understanding on this subject.
Kwangu I think ni watu waweze kujipanga, labda wakiweza kupata watoto wapange zile miaka ambazo watachukua ndio wapate mtoto mwingine, vitu kama hizo.
Ni kujichunga on a basis whereby una avoid early pregnancies, una avoid risky situations zenye zinaweza ku destroy your life.
To make sure uko okay physically, mentally na labda sexually if it comes to reproduction.
This information is critical to everyone who seeks to understand their body in order to make the right decision regarding their sexual and reproductive health.
Most of us don't even understand what is sexual reproductive health, especially women and girls with disabilities. And this is majorly because the information is, how do I put it? It's in a platform where only a few who are literate can access, but those who are illiterate cannot access. For example, I can say, way back before, persons with disabilities were not taken to school. So that majorly tells you that people who are older than me have no access to this information, simply because nobody understood that whether you have a disability or not, you're supposed to be educated. So accessing this information is majorly a problem.
This means everyone has the right to make their own free and informed choices and have control of their sexual, reproductive health and lives free from coercion, violence, discrimination, and abuse.
When you give an example with this young girl is able to have her body is functioning in a way that can enable her to claim or to have that right to maybe to give birth. That girl, if it's not underage girl, the ability to maintain or preserve herself until that time that they can make a good decision. That's the right coming in, the sexual right. Then the sexual health, maybe that girl, as she grows on, she has maybe the access to even sanitary towels, cuts across the menstrual hygiene knowledge, the knowledge itself, maintaining the hygiene that cannot tamper with her reproductive health.
Kenya is a state party to various international and regional human rights instruments that guarantee the right to sexual and reproductive health. Furthermore, the Constitution of Kenya 2010 for the first time guarantees the right to health care, including reproductive health.
Most people with disability cannot get that access to that information. Even getting the services, I find that people with disabilities are limited to getting the services as they may wish, or as the Constitution says that everybody has a right to good and quality health care. So we find that people with disabilities, mostly women, are left behind.
This underscores the importance of prioritizing the needs of vulnerable and marginalized groups in provision of healthcare. One of the most vulnerable groups in Kenya are persons with disabilities. According to Belinda, a disability sexual reproductive health activist, more needs to be done to ease the gap.
That most doctors don't understand disability, and disability is not something that is taught in schools. So if they see you with a disability and you've gone for family planning, first, before they think of how to help you to get the service, they pity you. And that is so wrong, because I feel you're not supposed to pity me if you can't change my situation. The best you can do is just deliver the services that I've come to get from your health facility.
In this case, who is a person with disability?
So disability is any condition of an individual that is not fully supported for them to function at their best level. We have to know that there are different types of disabilities, but a big criteria of it is it's either born with it, what we call congenital disabilities, or they can be acquired.
The Kenya society has been accused of marginalizing these groups of persons. This statement underscores the whole attitude around this matter for doctors and men and women with disabilities.
Society view people with disability, it's like they don't belong. We don't have feelings. We cannot have children. We cannot have families. We are supposed to be in the world where we just live and die. Persons with disabilities, they are human beings. They are women. We have women who have disability, we have men with disabilities. They have feelings like any other person. And it is important for them to know their rights, issues to do with their reproductive everything, and also to have the knowledge, to be exposed to this knowledge. And this goes all the way even to the healthcare services where they're supposed to be attended to. But it rarely happens. Rarely happens. Let me use myself as an example. When I went for the first clinic when I was pregnant, the nurse who was attending me, she asked me a very interesting question. What happened? She can see I'm pregnant, but she's wondering what happened to me. Well, I'm a very cheeky person. I asked her, what do you think happened? So she laughed and she knew this is a person with disability who understands what I'm talking about. But they always think either you were raped, this was a forced sex that got you into pregnancy, because you were not supposed to, according to the standards that have been set by the society. If I have disability, I should forget about having babies, having families, having all that. And so this nurse, she laughed and then she attended me. But I could see she was a bit uneasy, not understanding how to deal with me.
We take a short break, but we'll be right back with more. Don't go too far.
Abled differently. Abled differently.
Welcome back, and you're watching Abled Differently. Even with guaranteed sexual and reproductive health rights, for many persons with disabilities, the community seems to negatively influence the process, something that needs to change.
Dr. Mora believes the right to sexual and reproductive health must be decided by the individual.
Having a child is not just giving birth. It's about, can you be a mother to that child? That's usually my question. So even for me, even if I am a mother, there are questions I asked myself. Will I be able to be a mother to this child that I'm bringing to this world? Those are very important questions you ask. So it should never be a societal pressure. It should never be your father and mother asking you whether you're bringing grandchildren. It should be a decision that you're ready to take through. Now hear this. People with disability will probably get into more criticism than a normal, maybe single lady at some point who just decided to get pregnant. And that's another thing a person with disability has to ask. Can I deal with the criticism that people will bring to my table? There are people, by the way, who have overcome criticism. So that it should be one of the things you arm yourself.
This perception, notwithstanding, while seeking help a person with disability, is encouraged to be brave and prepared for this.
On matters sexual reproductive system, as a woman with disability, I understand the need of, getting to know deeper about my condition, because like I said, we have varied disabilities. All disabilities cannot be just, they're not homogeneous. We have diverse disabilities. So for me to be able to get assisted or probably get the right information from these health facilities, I first need to understand my disability and how it affects my reproductive system. So from there, you need to get that interest in getting to know what you put yourself up to. If you decide to go, probably you need to have a baby, you need to conceive, or when it comes to matters accessing the contraceptives and all. So as a woman, I need to first understand my disability before I can go to the health practitioners to challenge them about getting to know what I require from them. So it's all about, coming together, women with disabilities, and in conjunction with the health practitioners, health facilities, to be able to let each other in on what we would require from them, and then from there they can be able to understand what we need as women with disabilities.
While sexual reproductive health is a right, women and men with different disabilities are encouraged to seek this information by themselves to help them make the right decisions on this matter.
Issues are there for everybody in life. Take your own initiative too. One of the things is that a lot of times people fear taking initiative because they haven't been shown their value. So finding your own value makes you reach out for what is good for you. Okay? So that's what I would also say, that psychological rights are also equally for them, so that your value increases yourself, your value is increased. Therefore, even the things that you're asking, not demanding, asking for, you get them.
From my own experience on sexual reproductive health and women with disabilities, there's a big gap and a need for health practitioners to have interest at heart and also understand us as women with disabilities, because we are equal to the task and we are diverse.
What does sexual reproductive health information cover?
It composes of decision making, understanding your body. It also includes the family planning methods. It also goes beyond and talks about healthy and unhealthy relationships, where one is able to identify if he or she is having a good partner or not.
In spite of these elaborate measures, violations of the right to sexual and reproductive health continue to be experienced throughout the country.
The last 1 year, we have lost 3. And I cannot say that I knew them personally, but they were very active in social media. That's why when they died, it became like an outcry. First things first, it has not really been established properly how it was when they became pregnant to the time that they went to the hospital to deliver and they died. There must have been issues in between, possibly which were not identified in advance. One of the lady was in a wheelchair and the other two were on crutches. And these are just the ones who are in the limelight. We don't know how many more have died. I have a personal friend right now. She can't talk, and they're these short ones. And the problem is that when she became pregnant, she was given a choice, either to carry the pregnancy into term or they remove it. But she wanted to keep it. The doctor was very clear, according to her mother, the way she explained to me, that she cannot carry pregnancy into term. Something will go wrong. When she was 6 months pregnant, she slipped into a coma. Now they didn't have a choice. They had to terminate it because they were insisting that by the time it gets to 9 months, the probability of losing her, it's almost 100%. Even after terminating it, when she woke up, she could not talk, she could not walk because she was using crutches, and her memory, it never came back. So right now as we are talking, Mary is just somewhere, and the parents are the ones who are taking care of her. I don't know the connection between pregnancy and the seriousness of the condition that she has right now. So I think we women with disability, before we decide to become pregnant, we need to start the journey with the medics, with the healthcare service providers. We need to consult. We need to go through some checkups. We need to understand whether our body mechanism can handle the pregnancy. It's very important. Very important. And by doing so, I don't think we'll be able to lose lives. Because it is just something small that happens and the entire system collapses.
As specified on the United Nations Convention Treaty, persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. Unfriendly health practitioners, as well as inadequate support from partners in some cases, become barriers.
The barriers to sexual and reproductive health for people with disabilities, they cut across maybe from institutional barriers. We have individual like myself, we have community barriers, societal norms. So in the structural barrier, we find that we don't have good policies in place that that ensure that people with disabilities can access reproductive health and rights. In our Constitution, I think it's Article 56 of the Constitution, it says that the government should put in place affirmative actions that should enable the minorities to access good and quality health care. But find that when we don't have those policies in place, they may hinder people with disability to access those rights. You may find that even accessibility, the structures within the government, the healthcare and the county governments, you may find that the infrastructure itself cannot allow people with disabilities to access those services. A good example maybe in our maternities. I don't know, maybe we can have maybe countable beds that can give a woman with, let's say, a hatchback to have to deliver peacefully without that childbirth. We find that most of the beds are the normal beds. Do they consider for those with disabilities? Maybe that the normal hospitals we see, the beds, can it accommodate a person with short stature? How can she access that bed? You see, the information also. Do you have information maybe in braille language?
Dr. Mura, a general practitioner based at the Kenyatta National Hospital, believes this is gradually changing.
In medicine, we don't study disability the way you think we study it. We may know how to deal with the issues they deal with in terms of medical approach, but the psychological approach of how we deal with patients with disability is one thing. But there are people who are going out of their way to do that. So I must say that despite any person, any woman or man who went somewhere and got poor services in reproductive health and their sexual rights, that was just a failure on an individual, because now we are getting to push to know how we can deal with that.
Several players in the civil space have made strides in pursuing the rights of sexual and reproductive rights. Their approach has been to sensitize communities in order to address the underlying attitudes that shape the negative stereotypes and harmful actions against women with disabilities.
You can never change the system when you're not in the system. Get away to the system, then change the system from inside. So you must familiarize yourself with these people, make sure you understand how they view disability, then through your conversations, change the narrative from that end. And that is how you'll be able to fight stigma. At the end of the day, you'll realize, even if someone says, walemavu wanakuanga hivi, you'll I know someone who's not like that. You see, the narrative is changing.
Recommendations for change include disability-related cultural competence training for healthcare providers, making healthcare facilities more disability-friendly, as well as an emphasis on patient-centered care and behavior change strategies for healthcare providers and the general public.
The needs of a physically challenged person in seeking healthcare services may not be the same needs as the deaf, may not be the same needs as the blind, may not be the same needs as the short statures and other sorts of disabilities. Yeah. So we need this information to come out clearly, maybe research to be done, information to come out clearly so that it can disseminate to the communities and even to the health sector.
If Kenya is to fulfill its international obligations on the right to health for all, as well as attain the maternal health-related sustainable development goals, resources must be proactively allocated to support the most vulnerable and underserved segments of the population, including women with disability.
Clearly, a lot of work still needs to be done to ensure that accessible, affordable, and disability-friendly services are offered. We therefore call the relevant authorities to do the needful. I've been your host, Jane Theory. Kwaherini.
We are here and we are strong. Let's be counted as we move on. Make a difference, change lives as we tell our different stories. We are capable, beautiful, we are born to do great things. We're unstoppable, incredible, 'cause we're differently abled, differently.